Hello, I'm Dr. Nancy Lane from the University of California at Davis. And today I'm going to talk a little bit about sex differences in osteoporosis. Really? Now, why is it a little bit important to know the differences between osteoporosis in men and women? It's not exactly common sense because we think about women losing their bone around the menopause and becoming fragile. But the real interesting information is that when we look at the differences between men and women, when men have a hip fracture, they die twice as often as women in the first year. So when men get osteoporosis, it's not something that we should ignore. Now, when we talk about risks of disease, we often like to talk about the epidemiology. What are the risk factors? What are the risk factors that cause, the major ones that cause osteoporosis in men? Well, about 40% is primary osteoporosis related to age. And I will explain the biology of that in the next few slides. But it is also very important to remember in men that as common as primary osteoporosis is, secondary causes are also just as prevalent. So it's very important to ask about alcohol intake that affects bone formation, glucocorticoids that also are terribly toxic to bone, and also hypogonadism. About 15 to 20% of the major causes of osteoporosis in men are other causes, but those are by far and away not as common. So think about these as you work up men for osteoporosis. Now, as we transition from the epidemiology to the biology, I wanted to review for just a few minutes the determinants of bone strength and conversely, why the bone becomes fragile. The major determinants of bone strength are really the amount of bone you have. And in terms of risk of fracture, whether you've had a previous fracture and how much your bone is turning over. Is it forming and resorbing? Remember, resorption is so much more efficient than formation. So if you have a lot of bone turnover, you're going to lose bone and the bone's going to become more fragile. There are a few other aspects of what determinants of bone strength and alternatively skeletal fragility, how the bone mass is distributed, a little bit about the architecture, and sometimes the mineralization. These are really the determinants of bone strength and bone fragility. So as we think about those now, let me show you a little bit about the lifespan of bone. Most of you remember that bone mass accrues to a peak bone mass about the age of 25 in both men and women. Now remember, men get quite a bit more peak bone mass than women. Both men and women hold on to that bone mass, and then women at menopause around 50 have that dramatic drop. And then it slows to a gradual bone loss that continues throughout the lifespan of women. What happens to men? Well, they don't have this menopause. They have more bone mass to begin with. But long about the age of 70, you can see that men are in this gradual bone loss. And over time, from 70 on, men, just like women, continue to lose bone mass. And that results in bone fragility. Now, there is a major difference in how men and women lose their bone mass. And this is critical to understanding a bit about how best to treat men. When women go through menopause and their estrogen levels go down, they go into this high remodeling state and they perforate their trabeculae. So the distance between their trabeculae increases and makes the bone more fragile. Now, after menopause, in that gradual bone loss phase that women get in, they thin their trabeculae. And over time, that results in bone becoming more fragile. And that, everyone, is related to osteoblasts. Osteoblasts, when we all get old, men and women, they get tired and they don't form bone very well. Now, men, opposite to women, don't have that estrogen loss, don't have that perforation. They just start thinning their trabeculae because their osteoblasts don't have the energy to make bone. And that is really the major factor in aging bone, is that it is an energy deficit. When the trabeculae thin over time, they cannot hold weight, they cannot resist force, and over time, the bone gets fragile and breaks. Okay. So, when should men have a bone density? They really should have it about the age of 70. Women, we say 60 to 65. Any man that comes in with a fragility fracture, and almost any fracture, often men will fracture doing activities like they'll be cutting a tree and they'll fall down and break a rib. That is a fragility fracture. Anyone starting steroids, and also things such as concurrent medical conditions, a weight loss. Any man over 70 really should have a bone mineral density test. Now, the reason for that is almost all the medications that we use to treat women to prevent and treat osteoporosis are approved for men and work. And as I will show you, they work well. And in terms of approvals, the only medications that are not approved for men for the prevention or treatment of osteoporosis is raloxifene and estrogen. But all of our other medications that we use to prevent and treat osteoporosis are approved in men and work. Let me show you. So, in a very important study reported a number of years ago in the New England Journal of Medicine, men who were either had osteoporosis with a fracture or low bone density were enrolled into a study to look at once yearly zoledronic acid would treat osteoporosis in men. The primary endpoint was a vertebral fracture. And by the way, this was the first clinical trial in men that had a fracture endpoint. And it was 10 years ago. And sure enough, men with osteoporosis treated with zoledronic acid, after 1 year, you could see that there was a significant reduction in new fractures. And after 2 years, it was continued. So we need to identify men and we need to treat them. Now, as I mentioned to you, one of the major risk factors or issues in the pathophysiology of osteoporosis in men is their trabeculae thin, because their osteoblasts, as men age and as women age, get tired and they don't have the energy to make a lot of bone. Now, is it because the osteoblast doesn't have the energy or they don't get the blood supply to get the energy? We're still trying to figure that out in the laboratory. However, it brings me to the point that since the osteoblast reduced function is one of the major causes of bone loss and osteoporosis in men, it makes some sense that treatment with a parathyroid hormone agent that stimulates osteoblasts to make new bone works very well in men. And this is showing you a study where teriparatide was used to treat osteoporosis in men. And you can see both the 20 and the 40 microgram a day doses dramatically increased over 1 year, a BMD up to 10%, which is almost a T-score. So overriding that, osteoblast insufficiency definitely works to add bone mass to the skeleton in men. So I want to for just a few moments, talk about how we should think about treating men with osteoporosis. I think everyone realizes that and understands how to treat women, we obviously want to treat men at high risk who have fractures. But what about that intermediate risk? What about that man that we would identify on fracs? How do we deal with these patients and how should we treat them? We would look at risk factors. Please use the fracs, especially fractures, especially steroids, especially smoking, low weight. Those are really important. Use the fracs in men. I think most of you do. And remembering how to use the fracs, one of the most important little factors that I will bring in talking about men is you ask about a previous fracture. Most men will say no, but I will say that when you dig into that question a little bit more, and if you're in front of the electronic medical record, you can say to your patient, well, you had a rib fracture 5 years ago. They go, oh, well, I was walking and I slipped and I fractured my rib, or I was skiing and I fell down and I fractured my rib. That is a previous fracture. You've got to dig down a little bit deeper often in men than women in terms of broken bones. And once you put in that previous fracture there into the fracs, looking at the 10-year fracture risk, often it increases it. So please go over that very carefully with men. That's one thing that is different than women, and you may find their fracs is a lot higher. So that's what I wanted to say today. Osteoporosis in men and women differ. It comes a little later in men. The pathophysiology is different. But no matter what, both men and women develop osteoporosis and fragile skeletons. And please be aware of this. Identify men just as aggressively as you do women, and will really improve bone health. Thank you very much.